Nyabugogo bus terminal is one of the busiest parts of the capital, Kigali. Most public road trips in and out of the city start from this very place. This influx going on right now is seen less than 24 hours after 200 new cases of coronavirus were confirmed in Rwanda, the highest number registered in the country since the first case of the pandemic was confirmed last March. In the last 1 week, Rwanda has seen a surge in COVID-19 infections, with over 600 new cases, representing 20% of the total cases registered thus far, and 5 deaths. The spike in new infections, especially in Kigali, has sparked panic among Rwandans living in the outskirts of the capital. I'm worried by this pandemic that has no cure and vaccine. I've decided to leave the city and go back to the village because of this corona. People in provinces do not want to associate with us anymore because of corona. Up-country passengers no longer want to come to Kigali because they do not want to contract the virus because of the high number of cases registered in Kigali. Our province has registered a few cases despite being a distant rural area. We thought the pandemic was in Kigali. It is worrying, especially now that we do not have the cure and the vaccine. It is upon us to protect ourselves from this virus. Despite the increasing number of new cases, Rwanda is highly regarded among the countries with effective measures to control the virus across the world by different health professionals and multinational organizations, including the World Health Organization. But why are we seeing an increase in new cases? Citizens have their thoughts. We are being complacent and not knowing the seriousness of this pandemic. If all Rwandans fully embrace the prevention guidelines, wearing face masks, washing hands, and social distancing, we will defeat this virus. But some people are reluctant to follow these guidelines because they haven't seen the victim they know. Things are getting worse because some people are not adhering to the prevention guidelines. They think it is life as usual, which is not. Youth are among the people who have been largely blamed for the new cases in Rwanda. A section of citizens believe that the young Rwandans have become reluctant in abiding by the set prevention guidelines. Abdallah Murenzi, the coordinator of youth volunteers in community policing, talks about the measures in place to hold young Rwandans to account. From the moment there was a drop in new infections and easing of control measures, some people became complacent in abiding by control measures, even among the young volunteers who are helping the general public to respect set guidelines. Our message to the young people is that the pandemic is stronger than it was before. Health professionals are concerned that without deliberate action towards mindset change among people who are complacent in implementing COVID-19 prevention guidelines, then the country is far from winning the battle against this pandemic. What we're seeing is an increase in patients who are in critical condition, which might result into an increase in the number of deaths. This is not good at all. We want to see a drop in new infections and containing the spread of the virus to vulnerable groups. Nyabugogo and Kigali city markets have been epicenter of the recent spike in COVID-19 infections in Kigali. These markets have contributed the largest number of cases, followed by Rwanda's entry points of Kigali International Airport, Rusizi and Rusumo borders. However, Vedaste Ndahindwa, an expert in epidemiology from the World Health Organization Rwanda, believes that it is not too late for Rwanda to contain the spread of the virus. At first, we were in the green threat level indicator. We have surpassed the yellow level, now into the orange status, which is close to the red level. The red level is the highest and extreme, where everyone risks contracting the virus. But there is high chance of containing the virus, despite new cases in the markets. With strict measures, the virus can be avoided. The measures remain the same: washing hands regularly, social distancing and wearing face masks at all times, there is high chance of defeating the virus. China defeated the virus with over 80,000 cases, but we still have 3,000 cases in total. But we should not let it get to the level of 10,000 cases, because that will be extreme. Yet our economy is not as big as China. That's why we need to put a lot of effort in containing the spread. Than waiting until we have over 20,000 cases, the country will get overwhelmed. Over the last 5 months since the first case was confirmed in Rwanda, the country has since recorded over 360,000 sample tests. And out of those, over 3,000 positive cases have been confirmed, representing about 1% of the tests taken. Over 1,750 people have recovered. 1,300 are still in treatment centers, while 12 people have succumbed to the virus as of Sunday, 23rd August 2020. Reporting for RwandaTV News, AthanTashobya.